Hi, I'm Linda Henderson, Executive Director of Stonegate Arts and Education Center, and today we are visiting with Meagan Shipley. Meagan is the school coordinator for Lawrence County, and this is a podcast is part of a series that we're celebrating Public Health Week, this week of April 7th. And to start with, I'm going to have Meagan introduce herself and tell a little bit about herself.
Okay, thank you, Linda. And so my name is Meagan Shipley, and I've been in this current role for now officially 3 years.
Wow.
So the role is relatively new, new to the county and new to me. Prior to being in this role, I worked in higher education. And so I did that for about 8 years before coming into this role and working in kind of school and community health in the public health world. So I've done most of my work historically has been in school health, but just kind of in different capacities. And so I'm happy to talk to you about it because it's my passion.
Okay. What? Tell me, what does a school health coordinator do?
Okay. That is the million-dollar question, right? And so I know we'll talk about this later, but really my work is driven by the WISC model. And so we'll get into what that is, but really the goal is to get kind of everybody working on the same page to improve the health and academic outcomes of students. And ultimately, when you reach students, you reach family members, you reach siblings, you reach the broader community as well, because we know healthy students equal healthy communities, or healthy schools equal healthy communities. And so what I do on a daily basis is really kind of guided by where the schools need the most help. So as you can imagine, coming out of the COVID-19 pandemic, I think a lot of the work revolves around mental health and making sure that our students' mental health needs are addressed and taken care of. It also focuses a lot on employee wellness and just making sure that our teachers and the adults that are taking care of the students are taken care of by the schools. So a lot of what we do is we look at the programming that's happening in schools, making sure that it's evidence-based, that it's high quality, that it's medically accurate. We also look at our school health policies. There are usually mandates from the state of how often those policies have to be updated and what they should include, but our goal is, never just to be status quo. It's to try to go above and beyond the policies. And then looking at resources, like how do we get more resources available to the schools? So in terms of grants and other funding.
Now, you work with North Lawrence Community Schools and Mitchell Community
Correct.
Schools. Do you work with the charter schools as well?
So I am not assigned to the charter schools or to the to the private schools.
Okay.
But the health department has a school health liaison that they have through Health First Indiana funds that came. I think this is year 2 funding from the state. Okay. And so we've kind of unofficially divvied up responsibilities so that they can help those charter schools, and that I can take most of the responsibility for the public schools.
So what, as I did my research, your program is based on whole school, whole community, whole child approach.
Yes.
Can you explain what that looks like?
Okay, so in my field, or in like the public health world, right, we would refer that as the WISC model, just because it's easier to digest than the whole school, whole community, whole child model. But essentially the child, right, is at the center of that model. And so the goal is that children feel healthy, that they feel safe, supported, challenged within the school environment. And so to get there are 10 components, and I do this because it's a circle. And I have to think through the circle to think through of all the 10 components. But those 10 components are kind of what we need in place to get to that end product. So just to give you a few of the 10 components, one of those is family involvement. So we know that, health behaviors don't just happen at school. They happen at home. And so we can teach students to be healthy and we can teach them the skills that they need, but then we need reinforcing environments at home. Another component is health services. So thinking about the health care and the health services they receive in the school environment. So not only from a school nurse, but think about physical therapy, think about maybe speech therapy, occupational therapy. So those services that they're receiving in the school environment. Employee wellness is a component of the WISC model. So making sure that we're taking care of the staff, not only through things like health insurance and other benefits, but offering them, immunizations, offering them resources like their employee assistance program so that they can get help that they need. And then let's see. Oh, another component that probably people think of quite easily or naturally is the nutrition environment and services. So what are kids consuming in the school cafeteria, in school breakfast programs, in after-school programs, making sure that those meet state and federal guidelines.
So do you offer specific education programs for parents, instruction, or what kind of activities do you do to incorporate families?
Yes. So we sure are trying. And we really want to emphasize it's a team approach. Mm-hmm. And so, we're stronger when we work together. Mm-hmm. We have partnered with different agencies to offer programming for parents. First of all, the schools are great at hosting just family nights and other events for parents and families to attend to. And then also one thing we've really tried to do this school year is to get parents and families to understand the importance of school attendance. The state is really cracking down on school attendance, and so we want to make sure that we're offering parents resources and skills like how do you get your kids to school when they don't naturally want to come to school. And so just giving them that information. And then also really trying to promote what is taught in the school environment related to student social emotional needs, so that parents can use similar language at home. So what they're hearing at school, they're hearing at home, and so that their needs are being met.
So are parents receptive to your programming, or do you have good turnout, or could that improve?
I think there's always room for improvement.
Okay.
And I think it's just trying to figure out the different strategies and tactics that work. So, during the pandemic, a lot of things were moved virtually. And so always trying what do parents and families like? Do they like being in person, or do they like being virtual, or kind of having both? Obviously, time is hard because, parents and families, we don't expect them to come during the school day, but then also thinking about, well, what time is best, especially if people are working, different jobs or multiple jobs. So I think we're always trying to figure out when is the best time to reach them, where, right? Because sometimes it's hard, to offer programming at every school, but is there a place like Stonegate where we can come together that feels a little bit more neutral? So I think we're willing to try anything.
So is this coordinated school health program, does every school in the state have a coordinated health coordinator, or is this unique to Southern Indiana? Do schools adjacent to Lawrence County have a school health coordinator as well?
So it's not a required position.
Okay.
And I wish it was.
Mm-hmm.
And kind of how every county or school district operates is a little bit different. So I'm in in a group with other school health coordinators, and some are employed by the school, some are employed by other entities. It kind of operates differently county to county. I think the goal should be, right, to ensure that there's someone in every district or every county that's really looking out for students' health and wellness.
Just curious, I know Lawrence and Jackson County have a high juvenile obesity rates. As a school health coordinator, do you zero in on specific health topics like diabetes, obesity, and try to target those health topics, or it just depends?
It kind of depends on what the schools are most interested in.
Okay.
So if we were going to target kind of chronic illnesses, we would do so using the physical activity and education component of the WISC model, which I feel like we're always trying to advocate for movement for kids, just trying to get them active and engaged at recess and other physical activity opportunities. And then, of course, in nutrition, making sure that what they eat at school is kind of meeting their needs, and also teaching them valuable skills about like how to eat and consume healthy food, so that what they eat at school is similar to then what they would choose at home.
Okay. Are there any questions I should ask you that I haven't asked you that or information you'd like to get out into the community about your program, that this is a time to speak up?
Yeah, I just think it's always important to emphasize like what maybe you experienced in school isn't necessarily, not you, but just like the broader audience, right? Like a lot of times people think of coordinated school health or as school health as just what is taught in a health education classroom. And that's one piece of it, right? And that's a very valuable piece. And when health is taught so that it's skills-based, it's really influential and impactful. But there are so many factors that go into ensuring that students are healthy, and that they develop habits that they then take into college or the workforce, into life, into adulthood. And so we want them to receive quality health education, but we also want we want school to be a safe and supportive place. We want them to have trusted relationships. We want them to receive the care that they need in the school environment. So it's more than just a classroom, right?
More than health education.
Yes,
in 10th grade.
Yes, because Indiana, right, is slowly doing away with all the different health and wellness requirements. So it's not just that. It's really more about making sure that, all of their needs are met so that they can thrive socially, emotionally, and academically.
Meagan, I appreciate you coming today. I think a lot of people don't know that the schools have a coordinated health coordinator, and what the purpose is and everything. And appreciate you coming, and enjoyed visiting with you. If you'd like to come back and talk a podcast on any specific topic related to coordinated school health, just let us know, and we'll make it happen.
Thanks for having me.
Thank you.